I just went to the dentist. If you live in British Columbia, I have always had problems where dentists can't numb me. So I go in there and they numb me, it doesn't work. They don't believe me. They say I'm being a sensitive little baby and they hold me down and they do the procedure. Anyway, I can't feel shit. Dr. Jessica Church has all the medical conditions I do, and she's at Valley Dental Group in Chilliwack. I didn't even feel her use the needles to numb me. I did not feel any pain throughout that entire procedure, and I'm like, what are you doing? What the fuck kind of witchcraft is going on here? She actually became a dentist, like switched careers to become a dentist because no dentist could numb her. So she's like, fine, I'm just gonna be my own dentist and do my own dental work and numb myself. I love that bad bitch energy.
I know Dr. Jessica Church who has EDS, so I'm getting my tooth drilled on and I don't even feel it.
You here.
This is so fascinating.
You're learning lots of things.
Another thing that blew my mind is usually when I get a filling, you can like feel the filling and it like changes the bite of your teeth. She fully shaved it down, so my bite feels better than when I came in. Because 2 of my teeth were fucking grinding on each other, so she just like shaved one part down barely. And now my teeth are all evenly.
So if you, here we can look at an arch and we can just look at it. So this is showing me where you're biting. It's actually pretty even. Sometimes we see people who have like all red in the front, and then they're, those are the people who I was worried about. We talked about having the wear at the front.
Yeah.
You're actually not too bad. Even one little spot there. So that might be a little bit high.
And is that the right side of my face or the left?
This is me. It's not looking in the mirror. It's me looking at you. So this is actually your right side. That's your left side.
Okay.
Now look up top. I'm just gonna move this around a bit here. Yeah, a little bit heavy here. So you have a little bit asymmetry, but
I really need to start brushing more at the back.
Well, let's take a look here. Let me take a look at. I think it's mostly just staining that you're seeing. But let me just take a look at that. Yeah, so that's a little stain.
That's not a
in
cavity?
That. No, it's not. It's not a cavity. It's actually just So I know it looks like one, doesn't it? It's just it's like a little area where it's
salt and vinegar chips marinated for 2 days.
How do you not have like no skin left on, like my tongue?
Oh, I do.
Yeah, like my mouth is so sore when I eat those, but they are good. It's
I
like,
cut the inside of my mouth all the time.
It's okay. So we can see if it's a cavity. If we use this is infrared, and if it's a cavity, it actually shows up white, not black, which is really bizarre. So that's how I know. Well, I mean, also I could tell by like feeling it when we clean your teeth. But so here, if we want to look, if you do, like if we, let me just zoom out a little bit.
This is crazy.
Oh, that's the ink from. Sorry, let's go to this side. But like here, if you had, for example, as an example, if you had bright white showing here, that would be a sign of interproximal decay. We can sort of see that, but you don't have that. Wow. No, it looks good. I know it looks like I'm looking at a bunch of like ink blots. Oh, the spot that I just sealed is, remember how you had that little crater? It actually looks shiny. It still looks like it's reflective right there. That actually is where I filled in that little hole that was there. So you can still see the outline of the hole. Yeah. Because I have to still leave it like a little tiny indentation, otherwise you'd be biting high on it. But that brownness there is not a cavity. That's that hypomineralization. So you've lost some of the minerals out of your teeth. That's why it shows up whiter here. Yeah. So it's like, if you did not have good hygiene, it could be where a cavity could potentially form. But we currently are not at risk.
And the other thing too, like I really like her hygienists. They're really understanding because this tooth has like exposed nerves, and the last dentist that I went to, the hygienist, I was like, you can't touch this shit at all. Like I was so sensitive during the cleaning, she was fucking pissed off at me. And then I come here and I was like, you can't even touch here. She's like, okay. And they like weren't using the drill on me for the cleaning. They just were, I don't know, like sensitive teeth protocol. I was like, thank you for changing my opinion of dentists, because that was just phenomenal. I'm gonna cry. It's actually fucking crazy. And how did she put those needles in? She actually used numbing stuff in my mouth before she gave me the needle, which I've never, ever, ever had in my life. Didn't know that was even a thing. I've heard people talk of it, and I've been like, wait, what the fuck? And when she put the needles in, I don't know, she was like wiggling my cheek or something like that, and I could not tell she was putting needles in, except at one point I felt like pressure down here when she was in there, but it didn't feel like a needle. I don't know what the fuck she did. And she knows like the specific combos for people with MCAS. I laughed so hard too because she said I was talking to her about toothpaste in my mouth and stuff because she taught me that the skin coming off the inside of my mouth constantly is called sloughing. And she's like, yeah, I'm actually using this like bubblegum sparkle unicorn toothpaste right now. I went, bitch, me too. You're the Hello Kids toothpaste. She's like, yeah, I've been using my kids' toothpaste because it has like full adult level fluoride. And I'm like, that's hilarious you say that because that and the blue raspberry, I'd be mixing them even. And it's helped my mouth so much. Helped my mouth so much. My bite feels so good. I'm really lucky though. Them EDS doesn't fuck my teeth up that bad. No, just kidding, at all. Like my teeth are not fucked up. Which, when people ask me, what problem don't you have? Usually I say diabetes, but now I'm gonna say, my teeth. Well, wait, that's actually a lie, because they're so sensitive I can't even eat anything or chew, really. We'll just stick with the diabetes.